If you or someone you love has ever faced a difficult blood cancer diagnosis, you know how heavy that journey feels. For decades, our approach to cancer has been external. We use chemotherapy to attack the cancer cells, but it also attacked the healthy body. It felt like a scorched earth strategy. But what if I told you the most powerful weapon against blood cancer isn't a chemical made in a multi-billion-dollar laboratory abroad? What if the real answer has been quietly running through your own veins all along? Today, I want to take a few unhurried minutes to explain a treatment that is fundamentally shifting how we think about curing the blood cancer. It's called as CAR T-cell therapy. It sounds complex, but the philosophy behind is beautifully simple. It transforms your own immune system into a living, breathing drug. How it works? This living drug? To understand how it works, imagine your immune system is a security force. It has these incredible soldiers called as T cells. Their job is to patrol your body, spot the invaders and eliminate them. But cancer cells are incredibly clever. They wear a sort of invisibility cloak that allows them to hide in plain sight right next to your healthy cells. Your T cells simply sail past them, blind to the danger. CAR T therapy changes the rules of the game. Here is how we do it, step by step. Step 1. Collection. We gently draw your blood and separate those T-cell soldiers. Step 2. The training. We send these cells to a specialized lab. This is where the magic happens. We genetically modify them, essentially giving them a microscopic GPS tracker or a radar specifically tuned to find your exact cancer. Step 3. Multiplication. We grow millions of these newly trained super soldiers in the lab. Step 4. Return. We infuse these cells back into your bloodstream. The moment they return, they aren't blind anymore. Their radar locks onto these blood cancer cells, rips off the invisibility cloak, and your own body goes to work doing the fighting. It's a living therapy. Once inside, these cells continue to multiply and patrol. However, it's a double-edged sword. Now, because I'm a cancer expert and I will always give you the complete truth, this isn't a magic wand, it is a double-edged sword. Let's look at the advantages first. Unlike regular chemo, which you might have to take for months or years, CAR T is usually a one-time infusion. For patients with certain resistant types of lymphomas or leukemias who were told they have completely run out of options, this is the therapy that has brought about long-term remissions that we previously thought were impossible. But we must respect the risks because your immune system suddenly becomes incredibly aggressive. It can spark a massive internal storm. We call this Cytokine Release Syndrome or CRS. It can cause very high fever, a dangerous drop in blood pressure, or a temporary neurological confusion. This is why CAR T therapy cannot be just done everywhere. It requires a dedicated blood and marrow transplant unit, an expert medical team, and intense monitoring to keep you safe while those super soldiers do their job. For years, there was a heartbreaking catch to all of this. This technology existed almost exclusively in the Western countries, costing about 4 or 5 crore rupees. For thousands of needy families in India, it was a cruel reality. The cure existed, but it was entirely out of reach. But today, the landscape has changed. Thanks to brilliant minds at IIT Mumbai and Tata Hospital, India has developed its own indigenous CAR T therapy right in India. This isn't a medical milestone, it's a humanitarian triumph. Our homegrown version is designed to be highly effective, potentially with a profile that shows lower intensity of those severe side effects. Most importantly, it is available at 1/10 of the cost compared to Europe and America, opening a massive door of hope for thousands of Indian patients who needs it most. If you are navigating facing a difficult relapse, or if your doctor has told you that standard treatments aren't working anymore, please don't lose sleep or assume the journey is over. Medicine is moving at incredibly fast pace. Let's look at what is possible right now together. If you want to know if this treatment is fit for your family, leave a comment below or send me a direct message or come visit me at Yashoda Hospital, High Tech City, Hyderabad. Let's look at your options together. Stay hopeful.